Hi guys, welcome to Skin 101, and today we're going to be talking about hyperpigmentation, the causes, the prevention, and the treatment of hyperpigmentation. So let's start by defining hyperpigmentation. What is hyperpigmentation? Hyperpigmentation is the excess production of melanocytes in the skin, causing that patch of the skin to be darker than its surroundings. Hyperpigmentation can happen in any part of the skin, the face, the body, the hands, the legs. So, what causes hyperpigmentation? Hyperpigmentation can be caused by a variety of factors. For example, excess sun exposure. Excess sun exposure can leave you with age spots, sunburns, and just general darkening of the skin overall. We also have post-inflammatory factors like acne, burns, trauma to the skin, bruises, that would also leave a patch of a dark brown or dark patch in skin. We also have skin irritations like allergic reaction or a rash you get from using even a cosmetic product will leave you with hyperpigmentation. Excess friction in underarms, the groin, if you wear tight shoes around your ankle, that the excess friction will cause thickening of the skin, which will lead to hyperpigmentation. We also have hormonal factors also cause darkening of the skin around the neck. So yeah, those are a couple of reasons why you could get hyperpigmentation, and it's also important to note that melanated skin tones, we are more prone to hyperpigmentation than non-melanated skin tones. Okay, so now let's talk about the treatment for hyperpigmentation. So you have this post acne mark on your face or this bruise on your leg and you just want to get rid of it. How can you get rid of it? How do you get rid of it as soon as possible? So first of all, the thing I should say is that skin cell turnover takes at least 60 days. So when you want to treat something like hyperpigmentation, you have to have patience. Don't go for products that promise you that they're gonna clear your dark spots in 2 weeks. It's most likely not gonna work, or they have very harsh chemicals that might cause skin irritation and more hyperpigmentation along the line. So since the skin cell takes 60 days, 2 months to turn over, one of the things we can do to treat hyperpigmentation is to boost skin turnover with or speed up skin cell turnover with retinoids. So we have a couple of retinoids you can use from the strongest to the mildest. So in your cosmetic shop, come to my cosmetic shop, you can get adapalene, you can get a retinol serum. You can get La Roche-Posay has their retinoids under the brand name Epiclear. You can go for a stronger one like tretinoin, 0.1% of tretinoin, but you have to make sure you moisturize and use a sunscreen and use it only at night. I'll do a whole separate video for tretinoin. So yeah, retinoids speed up cell turnover. The next way you can improve or clear up your hyperpigmentation is by using active ingredients. So the active ingredients you're supposed to use to treat hyperpigmentation are tyrosinase inhibitors. Tyrosinase inhibitors, like the name says, inhibits tyrosine. Tyrosine is the enzyme essential to synthesize melanin. So when you inhibit that enzyme, the melanin is not produced. So that's how you help to reduce and prevent the formation of hyperpigmentation. So the gold standard for tyrosinase inhibitors is hydroquinone, and I know hydroquinone has a bad name, it has such a bad rep. People say that it causes cancer and all that. That research that said that it causes cancer was done in rats, and they gave it 80% its body's mass and they fed it to it, and then they also put it on topically, so it caused cancer in those rats. But in humans, hydroquinone topically it's given in 2 to 12%, and that is such a minimal amount that it doesn't really do that much. However, in excess amount it can cause oncrosis. Yes, so Hydroquinone is the gold standard, and then it's not supposed to be applied like all over the face or all over the body. If you remember, we defined hyperpigmentation by the excess production of melanin in a patch of the skin. So when you're using hydroquinone, you use it on just that patch that is darker that you want to lighten, not on the whole body, because when you use it on the whole body, you lighten your whole body, and we are not trying to lighten our whole body. So in other words, hydroquinone is not the enemy like people make it seem. When it's used correctly, it's actually the gold standard to clear out hyperpigmentation. But if you're adverse to hydroquinone, there are a whole lot of other ingredients, active ingredients, a whole lot of tyrosinase inhibitors that block the formation of melanin or reduce the formation of melanin, such as alpha hydroxy acids, alpha arbutin, licorice root extract, kojic acid, glutathione, niacinamide, glycolic acid, lactic acid. There are a whole lot you can look out for. All these tyrosinase inhibitors which help in treatment of hyperpigmentation. The third way you can prevent and treat hyperpigmentation is through exfoliation. However, this can be tricky because excess exfoliation can cause hyperpigmentation, and insufficient exfoliation could also cause hyperpigmentation. So if we're using physical scrubs, I would advise that you use the physical scrubs only on your body and not your face, and you should stick with the chemical scrubs, the chemical exfoliants for your face. So your body, you can use like a sugar scrub, a salt scrub, your sponge, exfoliating sponge. You can also use the chemicals like the glycolic acid on your neck and the areas of your body that have a lot of friction. And on the face, you should stick to just the chemical exfoliants such as lactic, glycolic, some chemical peels, alpha arbutin, AHAs, and things like that to exfoliate your face. And last but not the least, to prevent and treat hyperpigmentation is sun protection. And in this part of the world, if you're watching in Ghana or Nigeria, Africa, or anyway, sun protection, first of all, you should start by avoiding the sun as much as you can. And if you must go under the sun, under direct sunlight, you should go with protective clothing such as this, hats, and sunglasses, as much protective clothing as you can, and also the application of sunscreen SPF 50 and above. Make sure you have a sunscreen that you're comfortable with, one that you enjoy wearing, so that it's easy for you to wear it daily when you're going out under the sun. So recap for the treatment, we have speeding up cell turnover, tyrosinase inhibitors, exfoliation, and sun protection. Those are the 4 ways to treat and prevent hyperpigmentation. Okay, so now that we understand hyperpigmentation, the causes, the prevention, and how to treat it, let's talk about a very easy daily skincare routine you can follow to clear out your hyperpigmentation, prevent it, or just clear it out in general. So let's start with the face. So with the face, you want to start off with a daily cleanser that you like, any of your favorite daily cleansers. Ensure that you wash your face for at least 1 minute, dry with a clean cloth, and then go in with the toner. The toner should contain a tyrosinase inhibitor that you like. For example, niacinamide or glycolic acid. Go for a toner that contains both or at least one. My favorite toner is the ordinary 7% toning solution. Works wonders for the skin. After your toner, you go in with your vitamin C serum, and then your moisturizer and your sunscreen. That is for the daily routine. That is for the morning routine. And for the night routine, you start off again by cleansing your face for at least 1 minute, pat dry. Then you go in with your retinoids or your retinols. Remember, it's for cell turnover. So after your retinol, you apply a very hydrating moisturizer, and that is it for the night. Very simple. And then for the body, for your body, you want to go with a body wash that contains a tyrosinase inhibitor that works for your skin. So a body wash that has glutathione or kojic acid or licorice root extract. Going for those body wash as it's going to lighten your whole complexion and make your complexion more radiant. And then you should also aim to exfoliate at least 3 times a week with a sugar or salt scrub, making sure you exfoliate properly in the shower, followed by a very good moisturizer. So those are the 3 steps. If you know you will not be able to exfoliate that often, then go for an exfoliating lotion such as amlactin. Amlactin is a very good exfoliating body lotion. It contains lactic acid and urea, which helps with sloughing off dead skin and also cell turnover. So yeah, so that's with the body. Exfoliate, moisturize, and make sure that your products contain the tyrosinase inhibitors. Thank you so much for watching.